Welcome and thank you for joining us for another discussion in the I Am New Orleans Conversation series. I'm Kimberly Novod, founder and executive director of Saul's Light Foundation, a New Orleans-based support organization addressing the unique social-emotional needs of Louisiana's neonatal intensive care unit and bereaved families. And today, in honor of Prematurity Awareness Month, we've gathered the top local experts and advocates to discuss the importance of milk banks and human milk donation in the fight against premature birth in communities of color. For those of you unfamiliar with I Am New Orleans, it is a community-led conversation series to inspire action around critical issues of racial equity that impact our children. We want you to engage with us this evening as we discuss the importance of uplifting and empowering Black and Brown mothers in milk donation, tackle common misconceptions about milk banks, discuss the integral role our community plays in saving babies' lives. So get familiar with the chat box to add to the conversation and ask your questions. Throughout the evening, you'll see some polling questions pop up on your screen. This is another way to join the conversation and share your stories using the hashtag #IamNewOrleans on social media. Before we get started, there are a few housekeeping items I want you to be mindful of. The first is that this conversation offers live Spanish and Vietnamese translations, closed captioning, which you can access at the bottom of your screen. Today's conversation is being recorded so we can share with you and provide additional resources afterwards. Now, without further ado, let's get back to our panelists, followed by a short video about the amazing maternal child health work that the W.K. Kellogg Foundation is doing here in the New Orleans community. Tonight, joining us is Dr. Shelley Thibeau. She's the director of Mother's Milk Bank of Louisiana at Ochsner Baptist, one of 30 active milk banks in the US accredited by the Human Milk Banking Association of North America. As director, Dr. Thibeau partners with community breastfeeding advocates to improve equitable access to human milk for Louisiana infants. Next is Kenda Andrews Saunders. Hailing from Baton Rouge, Louisiana, Kenda Saunders is a proud mom of 6, military wife, and social media influencer. Kenda is the proprietor of a brand and marketing agency, That Kind of Love, LLC. Next, we have Dr. Julie Gallois. Dr. Gallois is an assistant professor of clinical pediatrics in the Division of Neonatology at LSU Health Science Center, and also she's a neonatologist at Children's Hospital. Dr. Gallois brings knowledge of breastfeeding medicine to Children's Hospital staff and NICU families, and she's an ardent advocate for a more breastfeeding-friendly environment. Rounding out our panel, we have Portia Williams. She's the proud mom of 2 breastfed boys, registered nurse, international board-certified lactation consultant, and maternal child health community manager at Touro Infirmary. She's also the founder of Nola Baby Café, a community organization that strives to increase breastfeeding rates in minority women through culturally relevant care, mentorship, and education. I want you to take a look at this video that's going to play next so you can get a bird's eye view into the discussion that we're going to have tonight about the importance of human milk and milk donation.
I've always wanted to be a mom. If you asked me when I was 5 years old what I wanted to be when I grew up, I wanted to be a mom. Going through breastfeeding and learning how important it is to NICU babies and how beneficial breast milk is and how many lives it actually saves. It's been very eye-opening, and it's been very humbling to be able to donate to other babies.
We process human donated milk. There are NICU families who can't produce enough mother's own milk for their infant. And so donor milk is the next best practice and medicine actually for the infants. So that's our primary customer, the preterm infant.
You're talking about patients that are not supposed to be getting fed. They're not in any position to suck, swallow, and breathe and coordinate all that. They are literally hanging on with every breath. The most efficacious way to get a baby through was to grow them up, was to try to grow them through the problems of prematurity. And the best way to do that is with food. Babies that were fed their mother's milk just seemed to make it out of the NICU faster, with fewer problems than the babies that were being fed commercial formula.
Certain cultures just don't trust modern medicine. They might think they're putting something in it or stuff like that. But when you have these kind of conversations about donor milk and the importance of having that as opposed to something else for a compromised infant, it raises awareness about it.
You know, and one of our goals is actually to get more women of color to donate their milk, to see that it is important that you can help save other Black babies if you donate their milk.
So by using donor milk and by using a mom's milk, we've made the playing field about as equal as we possibly can. So every single baby in a neonatal intensive care unit has the benefit of either donor or at least always human milk. Ten, 15 years ago, I was the skeptic. I couldn't believe that we would actually import and pay for another mother's milk for our babies. There's science behind it, and it is supported by the largest organization of pediatricians in the United States.
The time commitment for donating milk, it's really nothing because it's already part of your routine. You're already pumping for your own child, and it's just a matter of freezing the leftover milk. I just look at it as a gift.
Oh, it is absolutely liquid gold. So we've received 1,200 gallons to date, so we're comfortable that we're feeding the majority of the NICU babies in the state.
There's always going to be a story to the first batch of milk you process. One of our employees, she had a baby. The baby was at home, a couple months old, and baby died suddenly. And she had a freezer full of milk that she had pumped. And so she brought the milk in, and that was the first batch of donor human milk that we distributed to babies in the unit and anybody else that requested it and asked for it. Again, that one word that gets a baby out of an NICU is nutrition. And you end up with a happier, healthier baby. You're not in the doctor's office as much, and it's cheaper. Your hospitalization just shrunk. The cost of the hospitalization went down. So really, aside from a commercial formula company, everybody wins. It's a happy ending.
Wow. Now, considering that yesterday was World Prematurity Day, I think there were so many gems mentioned in that video regarding infant nutrition. And the one that stands out to me the most is Dr. Ginsburg, the neonatologist that was featured, his quote, "Everybody wins." So regarding the baby's health, the length of the NICU stay, the cost of the NICU stay, he said it can be a happy ending, right? So our question today, our conversation is going to be, how do we get those happy endings? How do we get the win? And so what I really want to do is go straight to Kenda. I feel like you have your pulse on the community, and I really want you to tell us, do people understand what milk banks are?
I don't think that it is as mainstream as we would want it to be. I think as a Black mom, I know that I did my, with 6 kids, I know that I did my share of time in the NICU and my share of time pumping breast milk. And honestly, my friends didn't understand it because there was this whole idea that, you know, if you could afford formula, oh, you had made it, you know. Mm-hmm. And that is, I think, a generational thing that we're going to have to learn to break generational curses. you know, so I know like my mother's time and her sisters, all of them, no one supported me with breastfeeding, me with making milk, power pumping. And they definitely were like, wow, if you were ever to donate milk, that's not that baby's milk. So I think there's just so many misconceptions. And I think it just starts with stuff like this, you know, being active and vocal and an advocate and teaching and learning, because right now, no, people don't understand the idea of milk banks in my opinion.
Mm-hmm. Now, two things you said I thought were really interesting, and I'm going to call in Portia to weigh in on this, right? The first is sort of the rethinking and retraining, right, our minds that we have to do to consider milk donation or receiving milk from a milk bank. And then I want to call in Dr. Thibeau, because I know as the director of the milk bank, she can tell us what some of those misconceptions are. So Portia, why don't you go ahead and weigh in?
Thank you, Kimberly. So the misconceptions that commonly that we try to debunk in conversations is that there's some kind of foreign substance in the milk that will harm the baby, or the milk is not clean, or it's dirty, or as we cannot ignore, some cultures have a not so great history with modern medicine. They tend not to trust. Certain experiments come to mind, so that lack of trust. And then also just like Kenda said, cultural practices. We do a lot of things just because the previous generation did effortlessly without thinking. So being that one person to have a conversation and do something different, sometimes you're met with a lot of resistance, and some of the resistance that you're met with has no actual factual basis. So I think to piggyback on Kenda, to have these conversations and be brave enough to say, you know what, this is what's best for my baby. And I know that you guys, one thing that I've seen firsthand with Kenda and her families and mine is that previous generations get offended when you do something different. Subliminally, you're telling them that the way they fed you or they fed their kids is wrong, but you don't want to tell them they're wrong. You just want to do something different and better for your baby. I mean, the numbers don't lie, and the evidence is telling us that premature babies and high-risk infants are faring out much better with breast milk than anything else.
Dr. Thibeau, can you tell us what are some of the misconceptions that people have about milk banks in our community?
Well, I'm going to piggyback off of Portia's comments of the recipients. They're concerned about the safety and the quality of the milk. They're concerned about, everything and anything to protect their infant. We do have a large lactation team, provider team that is aware of the safety and quality within the hospital. But outpatient wise, it really depends upon our milk bank team to share that information. The second common misconception is the donor process. We do have a vetted process, and it's designed that way to ensure the safety and quality of the milk. Yes, it has a couple of steps, and many times someone doesn't even consider donating until their freezer is on overfill and they're desperate to move the milk. So, yes, it's a tight timeline. We're trying to, make sure that their milk gets to safety in the donor milk lab, but we also have to ensure the safety of the donor milk. In our experience, when we explain this to donors, they are truly on board. They're donating altruistically, and they understand this. And also on our outpatient side, I feel like our conversations with the families helps relieve their fears, and they're all on board to receive donor milk. So communication and education is key.
Absolutely. I think education is key. Considering that, Black and brown moms account for about 20%, 10% each of the donors that are donating to milk banks. We can see how, sort of generational experiences and misconceptions can cloud people's judgment. I think this is a perfect time for us to go to the poll. I really want to hear from the people that are joining us online, and maybe they can tell us, how is milk donation perceived and understood in the community? So we want to hear what you think. Do people know what milk banks are? Do people know how they work? Some of these quality controls that Dr. Thibeau mentioned, is it something you've had experience with as well? So let's go to the poll and ask, how is milk donation perceived and understood in the community? I think our goal is to increase, right, the donors, human milk donors to milk banks, and to be able to make sure that babies of color are receiving this liquid gold, as it's stated in the film. And I think that that first step, right, is understanding, what does the community think? What does the community perceive? Here we go. So we got 31%. It's like a good hug. I've always wanted to do it. I love to hear that. I've never thought about it until today. That's a close second. It's hard to breastfeed. Now you want me to donate milk. And then lastly, I didn't know donating milk was a thing. I want to just open it up for anyone to jump in and give a quick reflection on the results of that poll.
This is Julie Gallois. So I thought it was really interesting about the amount of people who had said that they had never really thought about milk donation, or they didn't know milk donation was a thing until today. So as a neonatologist, I'm often meeting families in a time of crisis, right? They weren't expecting to have a premature baby that day, or a baby that required the NICU for some reason. And so not only did they never think that they would have a baby in the NICU, but they never really thought about if they weren't able to give their baby the nutrition that they wanted to right then, or maybe they were still so early in their pregnancy that they really hadn't had the chance to have a lot of conversations with their OB or with people that they trusted about the way that they wanted to feed their baby yet. And so a lot of times, I'm the first to introduce that concept to the family of, it's time for your baby to start eating now, and here are some options. And I'm so fortunate that we do have moms in the community who donate their milk, and we're able to provide that as a resource, because a lot of times when those moms, they're for so many reasons aren't able to provide the milk right away. Maybe they're sick, their body just hasn't started making the milk yet, or they just can't keep up. And so a lot of times people haven't thought about donated milk, or didn't know it was a thing until it's kind of a lot of things are happening all at once.
Mm-hmm. Mm-hmm. Absolutely. So I think what we hope to happen with this conversation is to sort of raise the consciousness of birthing people and families to consider milk donation when and if the time comes. And I think that's a perfect, segue really to start talking about the intersections of race, and then considering health disparities like preterm birth, which is what we're referring to. It's Prematurity Awareness Month again. And so knowing our community and where we are, the preterm rate amongst Black women in Louisiana is 55% higher than the rate of all other women. And so when you just think about statistically, this experience, preterm birth, is going to touch many of our families, right? If not ourselves, maybe our sisters or our aunts or cousins, or someone in our family. And so I think considering that rate, I really want to, Dr. Gallois, I want you to, jump in on this. And then Portia, I want you to weigh in as well, considering that super high preterm birth rate as it impacts Black women and Black babies. And those are, right, the majority of infants that are in the NICU due to preterm birth. And those are the ones who could really benefit from milk donation. What do you say? How can we help to educate mothers, specifically Black and Brown mothers, on the benefits of breastfeeding and milk donation when the majority of preterm infants are Black and Brown babies?
So I think events like what we're doing tonight and just getting the information out there, that's huge. The other thing is, the choice about, whether to provide breast milk to your baby. It's that the decision when you're having the baby, that's almost so late in the game, and having really good support from OBs and other healthcare professionals and other community members that can get that education out ahead of time to let moms know how important it is, but also to offer resources. It's not easy, right? So to also offer resources and support, I think is really huge.
And to piggyback on what Dr. Gallois says, you want to start having these conversations before conception, prenatally. As we know as medical professionals, that when a mom has a baby, she is very left side brained. She is emotionally driven, and all she wants to hear is that she has a beautiful baby and that the world is just cotton candy and rainbows. So to have these difficult conversations while they're processing things can be difficult. This type of information needs to be reinforced, not taught postpartum. So having events like this, having these community outlets like Baby Café, like Saul's Light, like doulas and community birth workers to ask these questions like, have you ever thought about donor milk? Have you ever heard of donor milk? And asking those open-ended questions. And that's an opportunity to clear up the misconceptions and just plant little seeds throughout the entire pregnancy. So when in the event that Dr. Gallois has to walk in your room during this kind of stressful, traumatic time, because let's not sugarcoat it, having an NI baby is traumatic and stressful. So when you come in the room and say, hey, have you thought of donor milk? You're like, I don't know if I'm gonna make it or my baby's gonna make it, and I gotta consider this, that, and the other. And then the amount of people that come in and out your room, it's like you're being, you're dodging bullets, but then you're telling me to be a good mom and make this decision. So let's have these conversations prenatal. That's why all of us working together to have these conversations and to do this work prenatally is so important. It's so important.
And also too, Portia, for the moms in the community to know that this is an option if they're fortunate to have some surplus milk, to know that it's a possibility. In the video, they talked about a mom who learned about the milk donor process during a time of bereavement, but that is one possibility. But there are other moms in the community who have a surplus and they can donate along the way, and they may not know that it's an option, or to know some of the processes, like Dr. Thibeau said, about how we can make it easy for them to donate.
And to piggyback on that, Dr. Gallois, the word "make it easy," we need to highlight the fact that it's not always easy to obtain a pump. It's not always easy to obtain the correct pump, or if you've had a C-section, or if you're having a premature baby because you may not feel well, to have to physically go to WIC or wherever you obtain a pump for, that can be very difficult as well. So those are some barriers as well. I think it's important that lactation consultants and healthcare providers ask mom. I can tell you on Baby Café, when we ask moms about pumping and what they're doing, if a mom says she has a surplus, the question is, have you thought about donor milk? Or do you even know what that is? It's just an open-ended question, and it just opens up the possibility of them donating their milk.
Mm-hmm. Absolutely. I think removing those barriers and, like you said, frankly, making it easy and telling people what their options are is a really great way to increase milk donation, but also make it an easier conversation to have with the mom of a NICU baby to say, have you thought about this option? And so I want to, really talk about when we think about the community level, right? What does it mean to promote and encourage and sort of uplift breastfeeding in general, but also milk donation. And then Dr. Gallois, you mentioned, in cases of bereavement, which is near and dear to my heart, how do we make it a common request or a common experience, so that, you know, people aren't caught off guard when we recommend donor milk, or people aren't caught off guard when we suggest this milk can be used for donation in times of bereavement or in times of surplus. So thinking through the community lens, what's the best way to do that? What are some creative ways we can promote that?
Well, Kimberly, in our experience, the bereaved mothers community really responds to the lactation team while they're in the hospital. And our best results have always been a bereaved mom that's working in tandem with the lactation team. Either they want to donate for research, or they want to also donate, you know, to have the milk processed for preterm infants. But the ones that stick through the process are nurtured by the lactation team.
And what a really beautiful way for a mom to really honor the life of her child by donating her breast milk, right? So that it can be used to nurture and give life to another baby that's you know, in the NICU, and maybe even, you know, struggling to survive. As Portia mentioned, it's not an easy situation when we have these tiny babies in NICU. And so just, you know, referencing the video, the best way to get them through and out of the NICU is nutrition. So we have to feed them, and human milk is best. Dr. Gallois, I want you to tell us why that is. Why is human milk best? Many families aren't aware of the benefits of milk donation, and so how it can help sick babies and premature babies. What makes human milk the best milk, best nutrition for these babies with medical complexities?
Yeah, thanks. So we know that there are benefits for breast milk for all babies. Even a healthy term baby is going to have less risk of ear infections or GI complications, higher IQs. There's so many benefits to all babies. I also want to throw in benefits to moms, because sometimes we forget that there's benefits to moms too, and not just the bonding, but also decreased risk of cancers later in life. So there are a lot of benefits for moms too, specifically for the babies who are in the NICU. And I think this comes up a lot with milk donation, because that's where a lot of the milk is donated to the NICU babies. So NICU babies face a lot of challenges. It could be breathing problems or eating problems or growing problems. One of the things that we fear in the NICU is a gut infection. It's called NEC. And one of the best defenses we have against NEC or this gut infection is to use a human milk diet. And there are lots of research going into what causes this disease and what we can do to prevent it. Mostly having babies be born later, but sometimes we can't control that. And so having the human milk and the human milk diet is one of the things that is protective against this disease that really causes a lot of problems for babies in the NICU. And lots of science behind a lot of theories about why, but it's a lot of the just the special proteins and the special immune fighting properties that are only found in breast milk.
If I can just chime in on that, because that really is a buzzword for me. I had my twins at 35 weeks, and my daughter, who was IUGR, she did have a neck scare, necrotizing enterocolitis. And when I tell you, I did so much research, and I learned that she needed my breast milk to be better, you know, and she was given formula, even though I requested that she only get breast milk. And the team there in the NICU where I was, they just assumed that I was not going to be able to produce enough for 2 babies, but I was producing it. No one was coming to collect it. And like Portia mentioned earlier, when you're a NICU mom in the hospital yourself, so many things are happening. And I'm like, no one's coming to get the milk. Do I need to jump up and run down there? You know, and without my permission, she was given formula. And that's when she had the NEC scare. And I mean, it was the most terrifying thing I ever went through. And that was the moment when I realized my baby needs human milk. I'm going to make human milk. Come hell or high water, be it a milk bank, be it me, it does not matter. And like so many have mentioned today, we don't know about that until we're already in the trenches. So educating beforehand is so important. And that's why I'm so honored to be on this panel today, because if we can reach someone and let them know about the importance of breast milk and the importance of this knowledge before you're in the NICU or before, you're like me and they say, okay, I'm sorry, human milk is the only option. If we can know that beforehand, I think we can get ahead of a lot of issues.
And I think what you had said too about permission and just that shared decision making would have been so huge, right? Because for some babies, formula is important, but for babies who are small, who are IGR or who are preterm, they have special needs, and different conversations need to happen. And so just talking with families and having shared decision, I think, is huge. And I'm so sorry that that was part of your experience.
Mm-hmm.
Thank you.
I love the idea of shared decision making, especially when it comes to, NICU babies, premature infants. I really want to, have Dr. Thibeau, Dr. Gallois, Portia, I want you all to weigh in on what it's like to bridge that gap of communication between healthcare providers and families when it comes to infant nutrition, and specifically when it comes to maybe some instances of implicit bias, right? Thinking that someone won't be able to make enough milk for 2 babies, or assuming that someone might not be interested in breastfeeding or pumping.
So Kimberly, the success I've had is assuming, and I know that's not a word we like to use, assuming that at the end of the day, this family wants to provide their baby with the best nutrition. However, someone, or some family cultural thing is in their way. So if I began by asking them, tell me what you know, tell me what you've heard, tell me what scares you, and I clear that out, it's like I'm clearing the road for them to be on their breastfeeding journey. And Dr. Gallois mentioned family-centered care. I don't think it's helpful in disparate populations to throw what the AAP says, what the statistics say, what the CDC said. That doesn't really resonate with certain populations who have not seen for generations their family breastfeeding. So just asking them, how does this look for you? How can you do this? Instead of saying, hey, I need you to pump every 3 hours, no sleep. Like if you do that, I have seen mothers get scared when you tell them, I need you to pump every 3 hours. So I've learned not to say pump every 3 hours. I've learned to say it may require you pumping about 8 to 10 times a day. Fit it in however you can. Let's come up with a plan, including them and taking the rigidness and the chore. Moms don't need any more chores. Taking the chore out of breastfeeding and pivot into the empowerment of like, hey, I'm the only, like Kendra said, I'm the only person that can do this. Like there's a meme that I see all the time that say, I make milk. What is your superpower? Like reclaiming the mom's superpower and letting them know that this is something that only you can do without the pressure. Moms have enough pressure on them. So just appealing to that and including dads. I hate to see a dad in a corner across the room while you're doing something to mom. Dads are caretakers. They want to be involved. So if I'm teaching a mom anything about breastfeeding, I will show dad and say, hey, dad, when mom's doing this, I need you to watch to see if it's dripping, or giving them a task so everybody can be involved, because unfortunately we can't always go home with them, and dad and the family is going to be there. So including everyone, even little sisters. Like we had a little 18-month-old, she was just running around while the mom was on Baby Cafe. And you could tell she was giving the mom a run for her money. So we got her on the screen and I told her, I was like, you want a job? It's your job to keep mama's water pitcher full because she's going to need water. So just including everyone just makes it so much easier for the family.
So Portia, that reminds me of something that I saw at a Baby Cafe event, and someone was wearing a t-shirt that said, breastfeeding is a family sport. That's what that reminds me of. Did you make that t-shirt?
No, that was the Healthy Start dads. They had that. Healthy Start made those t-shirts. They had the
That
black
is
and gold, and
amazing.
they used the Saints colors to say that it is a family sport. It's just not about the team and the mother. It includes the entire family.
Yeah. So you mentioned them, and then we know Baby Cafe. Where are some places that people can go to start to learn more about milk banks, about the importance of breastfeeding? What are some places in the community or organizations or people that we can shout out that is information and want to share it with our community?
So right now, I mean, prior to COVID, you can drop in certain places. Right now, you do have Nola Baby Café, you have Nola Breastfeeding Center, you have Cafe Olé, you have Cafe Con Leche. I always say this wrong. So Spanish version of Cafe Olé. Since we're stuck inside for the most part, everything is virtual now. So moms can just pop open their phones and look at certain things. Instagram and social media has taken over the world. So that's the kind of stuff that we need to think about when we're creating content, like Kenda's page and your page, just using social media to create content. Because like when you walk in a patient's room and they're on the phone, I don't tell them to get off the phone. I say, oh, you like your phone? Why don't you go to Instagram? And I want you to like this. I want you to like this. I want you to like this. Because if you give them a flyer, they're going to throw it away. But if you direct them to Saul's Light and Nola Breastfeeding Center and certain organizations, when they get on their social media, it's just going to pop up and it's going to keep popping up. So I think those are ways to encourage, to meet people where they are. That's where they are.
I love that. Absolutely. Meet people where they are. And so we'll be sure to drop some of those Instagram handles in the chat box because we know people are on their phones, right? Have to meet the people where they are. Kenda, you look like you were burning to say something. What are you going to tell us?
I've been burning. Everybody has such great things happening, so many buzzwords. I'm like, yes, that. But definitely social media has taken over, and just staying current, staying active, like staying on those timelines, like stay at their next, because that is the way that you get across. That is the way that you build your brands and people trust you. And then you have that integrity. But, finding what works for people, like TikToks. You see so many doctors now. It started with the plastic surgeons, but now it's everybody is on there dancing. They know the latest thing, so I know I did a breastfeeding video when my baby was a newborn and it went viral. And all these breastfeeding pages started following me. And I was like, look at like La Leche and all these people. And I'm like, wow, I didn't even realize all those pages were there. So I was able to connect with them and we've all just stayed in touch. So that right there is that lifeline, staying in touch through that social media.
Yeah, absolutely. Let's see what our community thinks. This is a great time to drop another poll. How can we encourage and support more Black and brown mothers in milk donation? And we definitely going to need the link to Kenda's TikTok that went viral about breastfeeding. If that's not meeting the people where they are, I don't know what is. I would love to see it. So we'll have a few more seconds on our poll. How can we encourage and support more Black and brown mothers in milk donation? So while we're waiting for that, I would love to hear, Portia, is there a Nola Baby Cafe TikTok? Dr. Thibeau, do we have a milk bank TikTok? Where are we going to meet the people?
I don't have a TikTok. I'm not even logged in, but Kenda's going to show me how to get this TikTok as I look for the baby. Are you talking about the baby mama TikTok, Kenda? Okay.
Yes, that was a few hours post delivery up dancing with her latched. She came out latched immediately, but at baby number 6, you learn the way. So that's another thing about breastfeeding. You get better every time.
And I was like, this girl just had a C-section 2 hours ago and she's dropping it to the floor. Where is her doctor's going to die?
Oh, yeah, that is amazing. So, okay, our community says Black and brown moms need all of it. They need to start from the beginning at the first prenatal doctor's appointment, provide more information about milk banks, and encourage employers to provide safe spaces. I love that because what it shows, right, is a little bit of what Portia touched on. Breastfeeding, milk donation is a team sport. And so if we want to increase both, right, we have to meet the people where they are. We have to be everywhere that they are, on social media, on blogs, in the community, at the hospital, at the baby cafe, the Nola Breastfeeding Center, right? We have to make this information accessible and available to everybody. And then one key thing, you know, that people showed us in the poll, and I know all of you can talk about this, is, you know, how do we start? How can employers play a more active role in supporting moms? Because we know that that is a very big indicator of whether or not someone will initiate breastfeeding, continue breastfeeding, or pump and eventually donate. Portia, why don't you go ahead and take a stab at that?
So it's one thing to provide a space for moms to pump. One area of growth is assuming that everyone knows where it is. I've gotten calls several times, the lady in radiology or the lady in another department didn't know where the pumping room was. And also, so having those conversations when someone comes back to work, instead of when you're coming back to work, what's your schedule? Tell me what you need. Are you breastfeeding? And having those I was fortunate enough to be able to pump. Like I would just go pump. Now with the nursing shortage, it's stressful because a nurse is like, I'm pumping, but like if I'm pumping and I'm trying to chart and we all know that the stress can kind of affect your supply. So just letting the employee know the options available and being supported, just like someone goes around and gives lunch. Hey, it's time, have you pumped? Because you can physically see when it's time. And having those realistic conversations about promoting your supply and providing, when you sign up for insurance, a lot of people don't realize that their insurance company will pay for your pump. They think they have to wait for WIC. It's just a lot of different things that you can do to help a mom pump.
Dr. Gallois, I know you can speak to this as well.
Yeah, Portia covered so much of it. The other thing is for moms to know that they are also protected by the law. So if your employer has so many employees, you have to be granted, if you're an hourly employee, you have to be granted a certain amount of time to pump, and the place where you're pumping has to not be a bathroom. That's another important thing. So you have rights as a mom, and so knowing what those rights are. So some of the resources that have been listed already can help you direct you to those places if you're having trouble. The other thing to mention out there too that's available for moms is, you know, we talked about a lot of the social media stuff that's been huge. The other thing is post-COVID, a lot more telemedicine has been available. And this includes lactation consultants or lactation visits also. So lots of the places mentioned have the telemedicine. Children's Hospital has a lactation clinic now, but places all over have virtual telehealth visits. And that's one of the things that COVID has given us is a lot more telehealth, and that's covered by your insurance too. So Portia mentioned your pump is covered. Every pregnancy, you get a new pump. And then if you have a baby in the NICU or who has special needs, you can get a special pump too. Not all moms know that they have a right to this. So that's part of our job too, is making sure that the moms know that they're protected by the law and they have rights to a lot of these things. And a lot of their insurances will cover the visits, the telehealth visits, and the equipment that they need.
That's just great to share, because if I could tell you the amount of girlfriends I have that were using their lunch breaks pumping in the bathroom, you know, and I guess, you know, your employer is not going to just offer up that information. So if, like Portia mentioned, if we could find ways to get that out more, you know, within the workplace, you know, and signage and things like that, that'd be great, because I don't want to have my lunch break on the toilet pumping milk.
Absolutely. So I think just that whole everybody involved, right? All the stakeholders. And who are the stakeholders? It's our community. It's our entire community. Families are the backbone of our communities, right? And so people that are breastfeeding and pumping need to be supported. And I think, what it also shows us is that if we want to be able to increase milk donation, we have to first make it possible for people even to be pumping comfortably, right? And they must be supported in whatever settings that they are, whether that's at work, whether that's in the community. So I think, Portia, considering your role at Touro and with Baby Café, how do you think we engage more community partners to be more welcoming to moms that are choosing this? And then how can we also sort of spread the knowledge of the importance of milk donation?
So one of the ways, just like we do everything else, we incentivize it. A couple of years ago, Greater New Orleans Breastfeeding Center, Ms. Shawn them started the business case for breastfeeding, and they were breastfeeding designated workplaces. And they had a nice little decal, and they had a sign, when you walk, breastfeeding welcome here. These companies were told that if you're breastfeeding friendly, that, you got more marketing. So, I mean, I'm sorry, but that's just the way we have to do things for the most part until we get more buy-in and engagement. You also want to have the community be more supportive. Like, we live in a city where you can pop up your shirt for beads, but if you're breastfeeding at Thanksgiving, it's disgusting. So we have to stop having these conversations. And something that I wanted to touch on earlier was that the generational curses of, like, for myself, I didn't see a woman breastfeed till I was 27. But had I seen that when I was younger, it would have been more ingrained in me to want to do that. So just having those kind of conversations. And if a child sees you breastfeeding, that's an opportunity to say, that is the proper way to feed your child. That may carry with them when they're older. Mm-hmm. Also, in the beginning of pregnancy, one of the things we do in the hospital, and Baby Friendly has taught us to say, are you breastfeeding? Not are you breast and bottle feeding? Because when you do that, you make them seem equal and level, and they're not. You just ask them, are you breastfeeding? Oh, so then you start having these conversations. There are many opportunities. Some facilities have meetings where they talk about potential high-risk infants while we're having these visits and NI tours. That's a wonderful opportunity to introduce the idea of, hey, in case you're separated from your baby, or in case while your milk is coming in, have you thought about donor milk? Mm-hmm. Have you thought about that? So those are all touch points. I had a conversation earlier today about the MFM visit. I feel like moms are the most engaged when they're coming to see the sex of the baby. The first visit, they may be ambivalent. They may be like, am I pregnant? No, I can't be pregnant. So they're adjusting to too much. Second visit, they feel it's kicking in, Kendra. You should know. It's kicking in. But that MFM visit, they're excited. I need to know the sex. I need to know what color drapes I need. So they're so engaged in that visit that I think that that's a wonderful touch point to have these delicate conversations. So that's just something that I've been planning to implement here to increase moms' awareness of what's going on.
Absolutely. So I think we really touched on, why talking about milk banks and donating are important. I feel like, someone said in the chat that we need more breastfeeding out in the open. I feel like if we destigmatize breastfeeding, right, then donation will follow. What do you say, Kendra?
Oh my God, y'all hit the nail on the head, because I like when you like to breastfeed, you like to breastfeed. Like Portia, she liked to breastfeed. And I am just like that. Once you like get on that wagon, but even with my own family and with my husband, he wouldn't want me feeding out in the open. He'd be like, no. And I just think so many people sexualize the idea of a woman having her breast out. And I'm like, you're feeding your child. So just having to teach people this is essential. this is life-saving. This is liquid gold. That's what's so important, because it needs to be out in the open. You shouldn't feel like you have to go somewhere and hide. You shouldn't feel like you have to cover up. And that is what I know I always experience, even with my own husband. So I love that Kate Parker said that in the chat.
Yeah, absolutely. So I think too, when we talk about making it more mainstream, right? Having it be a thing that's not really hush hush, something that we talk about in the open and something that we enthusiastic about, like Kenda is enthusiastic about it, right? How do we sort of harness that same enthusiasm for milk donation for those moms that have a surplus? How do we bring about that same level of interest and openness with that? And then, I really want to have Dr. Thibeau come in and tell us about, how is it possible? How do we donate? What are the steps to donating to the milk bank? How do people receive donor milk? So the first, I want to take it in two parts. The first is I want to talk about how do we raise that level of enthusiasm that we have for breastfeeding? How do we bring that to milk donation? And then how do we make milk donation happen?
Thanks, Kimberly. I would say that our lactation consultants are the main drivers of milk donation. They're the ones that are intercepting both prenatally and postnatally, helping and assisting moms. I've had more than numerous moms tell me that they were having difficulties trying to even establish lactation. And then once they were successful, there was an abundant supply. And then they were like, okay, what do I do with all this? So I really think the lactation team is the sole source of providing the support prenatally, post-delivery, and then ultimately leading to donations. Also, donations we ask all of our donors where their knowledge of the milk bank and donations come from, and it's social media. Kenda, I mean, you could agree with that. It is the main source of these women communicating with each other. But there's also a large component that credit their neonatologists, their pediatricians, their lactation consultants. So both avenues are very appreciative in donating and pushing the donations. So I think we've got the road plan. We just need to reach more people.
And I was thinking about, where do you go if you have a kid who's, like, for the most part, if you're pumping, for the most part, if your kids get less than a year, where are you going when your kid's less than a year? If you have older kids, if you have 5 other kids at home, like Kenda, all those places where, where your other kids are going, you're going there. But if your kid's 6 months old, where are you going? You're going to your doctor's appointment. So pediatricians, I think that's key, right? So you have to go to your pediatrician. Daycares, right? Maybe, if you're a working person, then maybe daycare. So these are the places. Just thinking about where are moms going if you have a kid who's under a year? Your pediatrician and to daycare. You can pretty much count on that. Other than, like, if the stores will let us, like, if you're buying a lot of milk bags, maybe you stick it in that little section of the store. I don't know if they'll let us advertise there, but that's where you're going. You're going to Target, and you're going to daycare, and you're going to the peds.
Yeah, we ask our donors, and they basically say it's their providers, lactation consultants, and social media is their main source of information. I don't know of anybody that's ever mentioned any other source.
Mm-hmm. I think that's key, having those available resources accessible and having the messaging everywhere. I think Portia can really speak to us about the importance of representation and access when it comes to this subject matter. Portia?
And you're absolutely right, because being the little deviant that I am, the only reason I became a lactation consultant, because I didn't see anybody that looked like me that was a lactation consultant. And my sister tells me all the time that if she wouldn't have saw me breastfeed, she wouldn't breastfeed. So just having people that look like you and talk like you. And I'm just going to be full transparent. I can go in rooms and say things that some people cannot say, because I know if your mom's anything like my mom, I know what you're going to deal with when you get home. Like, my son was 3 pounds and 15 ounces. My mama came to the NICU with pablum in her purse. He's barely breathing. How is he going to ingest rice cereal? what are we doing here? So just like, what are we doing here? Like, we talked about the community. We talked about the doctor's office. We talked about family. We have to talk about the certain cultures are structured differently. The Medias and the aunts and the nannies and the matriarchs of these families tend to be older Black women who feel the way they feel. So sometimes we have to finesse them. Like one trick I learned in a hospital is that you can't go against what Medea or grandma say. So what you do is you bring her onto your team because she has to go home with them. I mean, one time I tried to help a mom nurse and the grandma like popped my hand because I took the baby from her. But that's okay. My mama probably would have did the same thing, so it did not bother me. However, I asked her, I said, tell me, how was it when you had her? And I get the same response all the time. I had her and they took her away and I didn't see her for 24 hours. And I was like, so tell me how that made you feel. And they say how it made them feel. And I always say, because if you try to go toe to toe with them, you're not winning. So just give up. If I was to tell you that you are her biggest supporter, that you being on her team is going to help her, how would that make you feel? And that as a medical professional, I have to apologize for the years of us not knowing that that baby coming out and touching that mom and being close to that mom was the best thing for that baby. So we know better now. So we are going to teach better, and I'm going to help you help her. And when my sister had her baby, I'm rushing to the hospital. My mom was already latching the baby on. So just having, because I took the burden of, in some cultures, especially from my personal experience, me feeding my baby a different way subliminally told my mom that the way she fed me was wrong, whether I meant it or not. So bringing them on to and letting them know that this is the best way, and it's not your fault. We didn't create the optimal environment for you to breastfeed your baby. Like we took your baby, and your baby come back a day later, didn't get the smell, didn't get the skin to skin, didn't get all the things that needed for your milk to flow, and apologizing and empowering them. Most of the 99% of the times we get a good result. And that's when places like We Play come into effect, because we've had grandmas come to We Play and say, my son's wife is breastfeeding. I know nothing about breastfeeding, but I want to be a good grandmother. And this one grandma came like 3 times until she's like, well, I guess I'm just going to have to support breastfeeding. Y'all didn't, change my mind. So just doing stuff like that and repairing, someone put in the chat, repairing generational trauma. It's exactly what happens. It's exactly what happens.
Portia, I think that you really tapped into something really beautiful about the fact that of the 18,000 lactation consultants that we have in America, right, less than 10% are people of color. We're talking about Black and Brown people. And what I think you're saying, and what I think is beautiful, is that it's really not an issue of race. It's an issue of cultural sensitivity and cultural understanding. And that is why the representation matters.
That's exactly why it matters. Because if you have, for example, if you say, he'll make your WIC appointment, and you just give them a flyer, and that's not something you've experienced, you don't realize that sometimes they may have to wait for WIC. So picking up the phone and saying, I'm going to help you make this WIC appointment, because me speaking to WIC may get you a quicker appointment or a faster appointment, or appointment that, because there have been many times I've had to say, hey, she has an appointment in 7 days. Can she get one in 1 or 2 days? Because she needs a hospital grade pump. And well, who are you? I'm her lactation consultant at the hospital. And being able to say, oh, we don't have that. Oh, well, can I speak to a leader? Can I speak to certain people to get that for those families? Because if you're not aware of WIC in the process, then you won't know.
Yeah. Kenda, I saw you shaking your head. I want you to weigh in on that. I would love to hear your opinion on that as a breastfeeding mom of 6.
I just know that is the case with so many things. you just have to know your rights. You have to know what you're entitled to. You have to know what you deserve. So I've been there where, I wasn't just handed a pump. I had to be that persistent woman. And honestly, as a Black woman, a lot of times you don't want to be the sister girl who got to go get real trill on people to get what you need. But, if you have to do what you have to do, so be it. But you have to be the advocate for your baby, for your breast milk, and for your community. So I understand that completely.
I love that. Thank you for saying that. An advocate for yourself, for your baby. And really, when we think about milk donation, right, it's for your community. So for those moms of color that are interested in donating their breast milk, more than likely the baby that's going to receive that milk donation is going to be another premature baby, maybe, quite possibly a Black baby, just depending on statistics wise, right? And so I think that it's the essence of community love. It's the essence of advocacy and compassion and education. I think there are so many intersections. And I thank you really, for lifting that up. I think this is a great time to drop our last poll. And then Kenda, I want to go back to you because I saw another thought bubble up, but we really want to know, how does community generosity save babies' lives? Do you think it's more education about the benefits of milk donation, more doctor and hospital cultural competencies, more access in the community, better workplace policies and on-site access? That's also something that we talked about. So a few more seconds for you to participate in this poll about how community generosity saves babies' lives. And so while we're waiting for that tally, Kenda, I want you to finish that thought.
I was just thinking about, the great points you made about, when you look at the percentage of babies that are in the NICU, Black and brown moms, we need to be pumping milk like oil wells, and I think that just lights a fire, even under me. I am still nursing, and I'm like, I need to get my surplus up because these little babies might really need it,
Yes.
So thank you for that.
Yeah, absolutely. So, 45% more education about the benefits of milk donation, more doctor and hospital cultural competency. So that goes right there to that question of representation, and what Portia talked about, more access in the community, following on a quick third. I just want to say that I totally agree with that. So, my son Saul was born prematurely in 2014. Unfortunately, he passed away, about a month after his birth. And I was a grand producer of milk. And at that time, I did not have that information. I did not have that knowledge about, how prematurity impacts our city, how many more premature babies were in the NICU with him, and so without that information, my breast milk just languished in the freezer to ultimately we had a hurricane and had to throw it away. Right. And I think, that's something that we can learn about hurricane preparedness and what to do with that milk that's stored up. I think Portia and Dr. Thibeau can tell us about that. But just to echo what you said, when you know better, you do better. If I'd had that information, knowing what I know now, I could have recognized that my breast milk, my liquid gold, could have been used to save the babies in my community, which is really the goal. That's why we're all here. That's what we're talking about, is how to save the babies in our community, who are, twice as likely to be affected by prematurity. And so, I think this is a really great segue to really get a lot of your final thoughts. I want to know, what do you think about all of this? And I know, Dr. Thibeau, we need the information for the milk bank so people can learn how to donate and how to request or receive. But I just want to point out again that The I Am New Orleans initiative is centered on discussing issues of equity. And so, for those last final thoughts, I want you all to really consider and tell us, how do we create more resources to support moms from Black and Brown communities, Indigenous communities, to consider, those different levels of, as Kenda said, advocating for your baby, advocating for your community. I'd love to hear your final thoughts.
Well, Kimberly, I think that's a great segue on how to get donations. I think our major resource, as I've always said, is social media and providers. I think we just need to give them the power and the education and the information to pass it on. I also think the mom blogs and folks like Kenda are major influencers. We need to empower them with the information. I guess we could create a major bullet points for people to discuss and promote via social media. But when you discuss hurricanes, that's a whole nother realm. Hurricanes are very interesting, although we would love to accept all milk that people are trying to secure. We cannot offer, we can offer storage and of course, donations of approved donors. And we did that, and we came back one day after the hurricane, 2 days after the hurricane, receiving milk from people whose freezers were, obviously without power. But our hurdle as a community is what to do with milk from unapproved donors during this time. I mean, the last hurricane really taught me a lot. I'm beginning conversations with this, but there's just a very complicated process in storing unapproved milk. Either it goes to research and the consent process of storing milk and then returning it to the community is difficult. So I guess our best guess scenario would be to promote approved donors, and therefore when we have a storm, they can, secure their milk within a safe donation. I know that's not the most positive aspect, but I think there's a lot of work to be done there because we live in Hurricane Alley, and we need to accept that, and we need to be able to provide storage in some capacity.
And Dr. Thibeau, I think one little simple thing like dry ice. I don't think people don't realize if we live in Hurricane Alley, right? So if you're breastfeeding close to hurricane season, dry ice is what you need. If you're going to leave your milk in the freezer, you need dry ice. We
always post on our internet site, our social media, to store frozen bottles of milk. Frozen bottles of water. So just buy a case of water, stick all of them in your freezer, freeze them. And I did it myself for the last hurricane. My freezer lasted for 4 days. So, without power. Those bottles of water kept everything nice and cool. We were able to save all of our food, eat it as it went through the days. Wow. We stayed here, but it's a powerful, easy remedy. Dry ice is hard to come by when you come up to a hurricane because everybody wants it. And dry ice doesn't last long in your freezer. It disseminates very quickly. But if you can just freeze a case of bottled water, stick it in every nook and cranny of your freezer, it's liquid gold to promote the rest of your breast milk.
Thank you for that, Dr. Thibeau. You can count on somebody from New Orleans to find a way to.
Yes, indeed.
Some of the summaries of what we've talked about tonight that I think are so important is just providing the breastfeeding and lactation support to all the moms in our community, but especially our highest risk moms. And we know that just based on statistics, that some of our Black and Brown moms are going to have a higher risk of preterm labor and preterm birth. And so really focusing on how to provide the best education to them prenatally within their community support groups, within their healthcare organizations, and then reaching out to people and the way that they receive the information best. And what we've heard tonight is social media is one of those best ways, and then exploring other ways that we might be able to partner with some of our communities and our local pediatricians. And that might be a way that we can see some increase in the milk donations. And really looking forward to seeing all the great things that are going to come out of the conversations that we're having tonight.
Just like you said, with social media, I think that I found my niche with that. And I think that I know personally, I'm going to continue my efforts. You know, I'm one person, but each one teach one. So just continuing on that path of, you know, reaching out and letting people know, you know, being transparent, you know, making sure that I answer every DM I get when people ask me things about that, things about breastfeeding, things about, you know, my milk, things about my pumps, you know, from the Medela to the Willow, you know, I give recommendations. So I know that's my avenue and that's going to be my way to continue.
Portia, your final thoughts.
I am just so overjoyed and overwhelmed at the wonderful dialogue and conversation. I've gotten some goosebumps from Kenda. To see this full circle from, you know, a preemie mom, a health educator, a lactation consultant. This is I just keep going back to myself in the NI, not knowing about donor milk. Like that 2 days I was pumping and nothing was coming out. I could have slept and got some donor milk. Or not having somebody like you, Kimberly, to come sit by my bedside and say, how are you? How are you doing? Oh, I matter? Oh, I thought just a little bitty person in the bed mattered. So just having all of these resources 16 years ago could have made things much easier. And I'm just so grateful that the W.K. Kellogg Foundation is allowing us this platform to have this conversation. Because when we talk about an equitable, safe New Orleans, we have to go back to the building blocks. And the building blocks for all of us is the first part of our nutritional journey. And hopefully that's breast milk. It wasn't for me. Every time I get sick, flu season come and my allergies start bothering me, I tell my mom, if you would breastfed me, I wouldn't have these problems. And she just rolls her eyes, but my kids don't seem to have these problems. So thank you guys again.
Thank you all for your final thoughts. I also got a few chills just from hearing, you know, many of the things that was said. And I think it's just important to point out, you know, like in New Orleans, something that we do well is mutual aid. And so when we think about our babies, right, it's so cliche to say that our babies are our future, but they really are. They're the future of New Orleans. So everything that you love about New Orleans, these will be the next generation of culture bearers. And so what can we do to make sure that they get the next best start in life? We can breastfeed, we can donate our surplus milk and make sure that the babies who need it get it. I can't think of a more beautiful natural form of mutual aid than human milk. So we're gonna start that. We're gonna say that donating to the milk bank at Ochsner Baptist is mutual aid. And so that's something that we should do for our babies and for the future of New Orleans. Thank you all so much, everybody that's joining us. You know, we really want to hear from you. We want to hear your milk bank stories. Add to the conversation on social media using the hashtag #IamNewOrleans. And remember to visit the website, IamNewOrleans.com. Thank you to our wonderful panelists and audience and everyone involved that are working to improve maternal and child health in New Orleans, and for making this evening's event such a valuable and thoughtful experience. Thank you so much.